I think I read your last paper. It was the data-driven hour recommendation.
Oh, yeah.
And so this is something that like I am all about right now. So, and I think I read this correctly, but please correct me if I'm wrong. One of the things that you had trouble knowing was goal mastery, because that's something that I think you used in there. And so because goals mastered isn't standardized, right, it makes it really hard to know if the recommended hours are helping, because if one BCBA says, well, actually we do that in 5 separate goals, and then another BCBA says, well, actually we do this in 2, it makes it really hard to know how they're progressing. So can you talk a little bit about that?
Sure. No, I mean, I think you highlighted it. So the main idea behind the system generally, and it was a discriminative AI rather than a generative AI system, was to see, can we take the characteristics of somebody that might be typically gathered at intake, and then through this large database, can we try to figure out, based on those characteristics, how much progress they might make from a bunch of variables, one of those including hours per week. Now, the linchpin for any kind of system, again, I have inputs I'm trying to match to an output, is what I'm choosing as that outcome measure. And so you could do goals mastery, which has a lot of problems with it. You could do change and standardized assessments. Not everyone uses the change and standardized assessments. All that kind of looping back to your original question, practically pulling that off, I think in an ethically defensible way in day-to-day settings, requires that outcome measure to be something that makes sense to me with my company and is fairly well standardized. Otherwise, it's really hard to defend the validity of it, if that makes sense.
Yeah. And so how do you think, can you standardize this without going cookie cutter? Do you lose something there?
Some of the work that I've done with Mosaic Pediatric Therapy, where I'm at right now is the VP of Data Science. We're similar kind of a thing where we're trying to understand. So they use outcome portfolio, a batch of 5 standardized assessment, 4 or 5 standardized assessments. Everybody gets every 6 months. So at least we know the dependent variable means is close to the same thing each time. So there's going to be variability in implementation, all that. But within that, we also use as a signal in that 6-month period, progress on goals, which raises a similar question. Like, how do you do that across? What we found useful in improving the ability for our models to predict change in assessment scores was to normalize maybe I'll take a step back. So within a program, I can have like a skill, maybe a goal, maybe a program, maybe an overarching thing. Like there's a hierarchy of things that as a BCBA, I pick goals here, you label a goal something down here. So rates may be different. What we found is that BCBA clients relationships are pretty consistent over time. So within you tend to use the same hierarchy. Within me, I use a different hierarchy. And so if I normalize within a BCBA client dyad,
I see,
I can put everything on a similar scale. And when we did that, our models improved.
Okay.
Now, what's nice is that what we gained was our models got better predictive performance. We could use progress as like a signal to flag that maybe we should take a look at a client's case or something. The downside, though, is I've now, though, also lost the ability, and maybe this already I didn't have this ability to begin with, but I can't really talk a lot about why goal mastery or progress matters or trust that weight, because I am weighting it differently across BCBAs. It doesn't mean the same thing.
Sure.
So again, predictive validity, but it still makes it hard to know what to do with that feature or that variable if I wanted to interpret the model in some way.
For our ABA agency, we used like really we just use it for a screener so that myself and the clinical director could like quickly just glance and be like, okay, something's going on here, right? Like
Nice.
Like plateaued.
Right.
Then you have that conversation with that individual,
Right.
about the individual client. Say, what's going on here? Oh, well, grandma's been in town, or because the main reason that we did that was because if as we grew and we weren't we were trying to figure out how to give the BCBAs their autonomy and also like not micromanage them, but then also keep an eye on things, make
for
sure
6
things
months
are
we were doing something.
If we had like a text that came to me and was like, hey, I haven't, my BCBA hasn't updated the programs and all my kids' targets are mastered out and we're just sitting here. Right. And so we were like, okay, how can we, what can we put in place to be able to like, see that before the tech even has to come to us to say it. Right. So we had like monthly, case reviews. And so that was one of the things. We just had like a chart at the beginning of every kid's, file or whatever. And we just kept an eye on it. And, this was before a lot of the new practice management software. So maybe some of this is already within that, but that was how we looked at it. But then we were also trying to figure out at the time, like, how can we use this to, provide incentives. And then we ended up not doing that because we were worried we were going to like incentivize the wrong thing.
Yeah, so like we do see some companies using skill acquisition as an incentive program. And this is my concern is like, are we incentivizing the wrong thing? Right. And if you say, well, if I break this down into 10 parts instead of 1, I get more performance and then I get more, I may get a higher bonus. And then the other concern I have particular to this is, do we then screen our cases so that, okay, well, I don't know if this client will perform as well as I need to get my benchmark. And so I'm just not going to take this client. You know what I mean? So, do you see any way to, and I'll say this as well. Is there an easy way to define what quality is and then measure that across a company so they know?
Yeah. I think yes. I think it's probably going to vary perhaps by company, or at least till we get a lot more research data on it. But one thing I think, and if you look at the quality measurement literature generally, there tends to be like 3-4 buckets of things that people measure. One is that outcome measure that we've already started to allude to. The one nice thing about standardized assessments is it does move off of targets mastered. It's harder to game the system, especially if I have people or maybe an independent assessment team or something like that. But the other couple of categories are process measures and structure measures. And these are just from healthcare quality measurement literature is where I'm pulling from. But process measures are the things that I do as a healthcare provider that research suggests are associated with better outcomes. So usually I still need to know what that outcome measure is already. But like, for example, maybe my outcome measure is the number of patients who undergo heart surgery that die on the table. That's a pretty obvious outcome measure. Now there's all sorts of stuff I can do in there that are associated with that, and I can track those and incentivize those. And then there are other batch category are structure measures. So what is the structure of the company and physically and like the larger environment that then influence my behavior, the process measures that then relate to outcomes. And so all that kind of looping back, I think there are ways that a company could be smart generally about how they choose the outcome. That's kind of their North Star. And then the types of things that I'm reinforcing or providing incentives for on the behavior of a BCBA, database decision-making, right? How often are you actually getting in there? We know that total number of learning opportunities in a session tends to be positively correlated with goals or outcomes, stuff like that. So I think there's enough behaviors that we know exist from the research literature or that it seemed to be obvious enough that we could target. And then as a company also, right, I should be evaluating my operational staff, right, my IT team, right? People have the things they need to actually do what we're asking for? And that's because where we're at as a field, I don't know that we have, like heart surgery, a clean structure process outcome that everybody, regardless of hospital, like we know these things matter. Maybe we're moving that direction. So that's why it still feels like it's probably going to be variable across companies. Yeah. But there's probably some larger buckets. I bet as a field, we would all agree, like, yeah, that's, number of learning opportunities should probably be more than one every 10 minutes.
Yeah, that was one of my dreams. A couple of years ago, I had to give that dream up for now, at least. But I wanted to do like a whole quality summit, and I wanted to get like all the greatest minds in ABA together to like really look at this and say, okay, how can we truly measure quality, right? That was like my passion there for a minute. I was like, and then I realized just how big and grandiose that was. And then I just, but if anybody wants to take that idea and run with it, you have my permission.
Yeah.
And maybe there's already a few things. I know that like NASCN, I know that they're like really Bryant Silba over there. Like they're really doing some really cool things.
Work,
So I'm excited to see more about, you know, what they're doing.
Related to that, Bryant, Cody Morris, and I were co-special guest editing a special issue for behavior analysis and practice on quality measurement, where the goal was like database stuff. So less talking, but more people showing like from a data perspective, how do you go about this stuff? So
I love it. I love that that's a big question that gets asked a lot, you know, is like being concerned about quality, right? There are more than I thought. It actually kind of renewed my spirit in the field a bit. And to hear how many people are really concerned about, am I doing the right thing? Am I supporting my team? Am I, you know, how do we know if what we're doing is really providing quality to the field and in a whole?